So this week, there's maybe just the tiniest bit of good news and maybe reason to be a bit hopeful, but we'll have to see what comes out over the next coming weeks. And that's because if you look at the case trends, and this is the Ontario curve, you can see there's been a bit of flattening of the curve over the last week or so. Likewise, when you take a look at Niagara's curve here, you can see it sort of has flattened out a little bit over the last little while. And that's, I think, a bit different than what we had been expecting, particularly given that nothing particular yet has been done to really try and slow the spread of infection. Now, the flip side of that is, could this just be a temporary pause before it resumes going up, similar to what maybe we saw here or back last fall? I think that's the worry, but it is at least a small bit of good news for us. If we're looking here then, across a bunch of other health units that are our peers, you can see that, while some of the lines are still heading upwards, including ours here, which is the green one, we flattened out a little bit after this data stopped. You can see Hamilton here is actually taking quite a sharp decline after really being the runaway of one of the places with the highest number of cases. And you can see several other regions here. This one here is, I believe, Peel region, a few others are definitely showing that flattening happening early. So it does sort of make sense that maybe across the province, some hotspots like Hamilton got under control. And that has meant that some of us in neighboring regions have managed to flatten out a little bit. Now, the modeling put out by the Ontario Science Table a couple of weeks ago was expecting that we were on this sort of trajectory going into the month of September. And we're worried that actually we were trending more to being on this darker trajectory. If you look at us where we're, closing in on the halfway point of September, the thinking was we might be close to about 2,000 cases a day in the province. And we're fortunately still holding under 1,000 cases a day. So we may have actually somehow managed to at least get onto this green curve, at least temporarily, which means it buys us a little bit more time to continue working to get vaccinations up and bring cases under control. And hopefully that's something that we can maybe sustain for a much longer period as well. Just showing the national modeling here. This again, was showing that the blue line was what they were saying would likely happen if people increase the number of contacts, and these red dots showed what actually did happen. So very much trending with that worst case scenario rather than the medium case scenario, which is this gray line. And they're still projecting that we could potentially be heading for a pretty high number of cases. But of course, that's at a national level. And of course, that includes all provinces, including places like Alberta, which had a bit of a different outcome from us. So the good news here is that it does look like in Ontario, we may be deviating from what the modeling was saying was going to happen. And we might be seeing at least a short period where our cases don't go up quite as quickly. To understand why that's happening, one of the big drivers of our cases is, of course, the variant, and particularly the Delta variant. And you can see here that everything that is in the Delta variant is basically at zero. Our cases were really the orange line here, which now represents the Delta variant, and that was heading upwards. And we seem to have been able to flatten out the Delta variant. There hasn't really been a shift in what variant we're seeing, so it's not really accounted by there being a more easily controlled variant that's allowing us to get cases under control. So I don't know if that necessarily explains things. Likewise here in Niagara, we're seeing virtually everything here as a Delta variant. 79.3% is likely Delta variant on screening. Another 20.1% we know for sure is Delta variant. So you're looking at 99.4% of our cases in the last 28 days have been the Delta variant. So, we're still fighting the Delta variant, that hard to control version of the virus. And there hasn't been a change there that explains why we've seen a shift in our case curves. If we're looking at people being out and about more, that was the other big driver of why our cases were up. You can see we haven't really brought in new restrictions in the province here. So the stringency index has been pretty flat. And likewise, the amount people are out of home and mobile in the community has really been pretty flat over this time, which makes sense that the restrictions have been flat. So people's activity has been pretty flat. That hasn't come down, so that doesn't really explain why our cases have shifted. And actually, if you start to do a breakdown, you see the kind of flatness in the retail and parks, etc. You do actually see a bit of a spike of more mobility around walking and transit. Transit is perhaps up because early September, universities are back, schools are back, maybe some workplaces have been back up and running. Perhaps that's part of what's explaining the walking as well. I'm not sure. But there's nothing here to say that there's been some kind of shift in mobility that would reduce people's social contacts and result in cases coming down. And likewise in Niagara, if we're looking at people staying home, they're staying home less than they have throughout this pandemic. It's relatively flat though how much they are staying home. And they're out and about, doing shopping, recreating really more than they have ever in the past. And so a shift in people's behavior doesn't really seem to be explaining why our cases have flattened out. So that makes me worry that this might just be something transient, that this is not something that's going to be sustained. But nonetheless, it's good news that we've at least slowed for a period of time. And that does buy us more time to keep vaccinating and hopefully get things in a better shape before we start to see cases start to go up again. And of course, the better we're prepared for by the time the cases go up with more vaccines out there, the less that rise will be and the less likely we're going to need to see any kind of onerous restrictions in society coming forward. Of course, the reason we care about cases is a fraction of cases turn into hospitalizations, people severely ill, and unfortunately, in the worst case, people passing away. We've seen around the world and in other parts of Canada that as cases gone up, more pressure has been on hospitals and ICUs. And the US is, of course, the case we hear the most about, but we can see increases in the UK, in the Netherlands, and other countries. We here in Ontario had the small increase, but not a huge one. If you zoom in here, this is going up to about 80. So we're basically zooming in on just this bottom part of the graph here to look at Canada, because fortunately we're doing better than the rest of the world. You can see the rise in Ontario has been better than some provinces, particularly Alberta, where there's been a big spike. The modeling was saying that we would see an increase in our ICUs that could rise to a pretty worrying level by mid-October. Fortunately, we seem to maybe not be seeing those case rises. Here at September 13th, if we had that best case scenario where we got onto that green line without the case increase I showed earlier, we could be around 200 ICU beds, and we're actually just around there. We're just around a little over 190 ICU beds occupied in the province right now. So we do seem to have gotten on this green trajectory with ICU occupancy as well. That being said, of course, this line doesn't start to come down. It stays flat if we do this. And if the case flattening is only transient, as I worry it is, this could start to pick up again. But of course, once it picks up, that hopefully means that we've bought ourselves a little bit more time to keep putting things in place and vaccinating to make sure things stay under control. We look at the Ontario hospitalization curve of late, you can see, it's still going up, though it's not going up quite as sharply. And then the ICU numbers, have gone up a little bit, but you're seeing that flattening out I showed on the previous graph, where we maybe are flattening out close to just under 200. And then here in Niagara, we've definitely seen our hospital numbers go up, and we've seen our ICU numbers go up. And, hopefully those won't go up very much more than with the slowing of case growth, at least for the next little while. Now, what we need to do in this time that we're buying here is, of course, put in place things that will hopefully make this reduction or case growth sustainable, so we can keep case growth slow or flat, or perhaps even if we're lucky, start to bring it down again. The Public Health Agency in Canada always emphasizes this. If we increase the number of people we have close contact with, you shift onto a curve where there's steeper growth. If you maintain or reduce the number of people you have close contact with, you can shift that onto a lower case curve. And the Ontario Science Table basically showed that as well, that if we were where we were through the month of August, where contacts were at about 80% of pre-pandemic levels, you could see a big, huge surge of cases, leading to then a huge surge in ICU occupancy as well. But if we got that down a little bit, back down to 70% of pre-pandemic levels, we see an increase in cases and increase in the ICUs, but to a level that is much more manageable and wouldn't overwhelm us. And so one of our goals is we want to keep trying to figure out how do we break off those social contacts in the places where they potentially will lead to the most spread, so we can move ourselves onto one of these case curves and these hospitalization curves that's much more shallow. Obviously, a part of that is what the province is going to be bringing in next week, where restrictions in indoor dining, use of banquet halls indoors, going into indoor gyms and the like, is going to be limited to people fully vaccinated. And so that means that contacts are going to shift in those highest risk settings to groups who are vaccinated, where the risk of spread is going to be lower. And that's one part, I think, of moving us onto this sort of trajectory. Another part we're thinking of locally is trying to figure out what are the pockets of where we have infection spreading so we can address that. If we're looking at, a breakdown of where outbreaks are in Niagara, you can see first off, since August 1st, overwhelmingly our cases are not in outbreaks. They're out in the community. And overwhelmingly these cases are people having private social gatherings. And so as much as possible, we want to keep encouraging and keep convincing people to avoid those private social gatherings unless it's with a vaccinated group of people, because once you have unvaccinated people there, that tends to be those opportunities where we see a lot of infection spreading. And then if we're looking at where our biggest sources of outbreaks have been, it's here in the food services sector, it's in healthcare facilities, and it's in social settings. And these social settings are places where people congregate for social events. When they have a wedding, they have some sort of social party, they congregate in a place of worship, in a community league. Those kinds of places seem to be the other big area where we're seeing outbreaks. And if we actually just count the number of outbreaks, so taking out the number of cases, but just the pure number of outbreaks we've seen in that period, it looks kind of like this. And so, there's actually a big chunk of our outbreaks are, people being captured within outbreaks occurring outside of Niagara. Usually because it's outside of Niagara, it only involves 1 or 2 Niagara residents. So, it's a very large number of outbreaks, but fortunately not that many cases. But the biggest concentration of cases in terms of our outbreaks is here in the food services sector. It's here in workplaces. And the education sector, we're seeing a little bit here in social settings again, and over here in athletics. And so these are some of the big sectors we're thinking about, especially the food service sector, but also workplaces, social settings, healthcare facilities, workplaces. What can we do in these areas to try and reduce the spread of infection? And so we're thinking about what are some of our options there, both in terms of decompressing, congregating people there, reducing the number of people there, but also encouraging additional vaccination efforts, encouraging them to try and limit people in those settings as much as possible to a vaccinated group, so you limit the potential of infection spreading. So hopefully we can keep this flattening of cases something that becomes sustainable over time. Really, the emphasis, of course, is on vaccination, because long-term, that's what we want to be relying on to keep our cases under control, because we don't want to keep seeing restrictions in our social amenities, our private businesses, and the like. And we can see definitely that there's a big difference in risk amongst people who are fully vaccinated versus unvaccinated. This is from the Ontario Science Table, showing that if you're a case of COVID-19, how much greater the risk is in an unvaccinated person than a fully vaccinated person. And you can see that if we shift over to hospitalizations, that difference is probably even starker. And fully vaccinated people have very low risk of ending up in an ICU, but it's still very substantial for an unvaccinated person. Now, this is the Public Health Agency of Canada's data, kind of showing similar kind of trends here. Chance of becoming a case of COVID-19 if you're unvaccinated versus fully vaccinated, a big difference. Likewise, unvaccinated and fully vaccinated becoming hospitalized, a big difference. They actually quantified that as, if you're unvaccinated, 12 times more likely that you can get COVID-19 than if you're fully vaccinated. Hospitalized, you're 36 times more likely than someone who's fully vaccinated. And then, of course, in Niagara, we put out similar data, and over the past 28 days, we had about 8.4 times more likely that you're going to be a case of COVID-19 if you're unvaccinated as compared to if you are fully vaccinated. And Niagara Health has been putting out their data on what their hospitalized patient profile looks like. Right, their latest update on last Friday, which was I think up to September 9th, showed that all of their cases were unvaccinated people. There's nobody fully or partly vaccinated. And actually, if you look at overall what they've had since August 7th, overwhelmingly the cases have all been unvaccinated people. Very few people are being hospitalized when they are fully vaccinated. And so ultimately, we do need to shift to higher vaccination rates as being the way we're going to get the pandemic under control long term. The Public Health Agency in Canada has put out their modeling showing that if we got vaccination up to 79%, this would be the hospitalizations nationally. And you can see these gray lines shows, different scenarios of what might happen. This black line is the average of those scenarios. Lots of scenarios, almost half of the scenarios, we're going to exceed our hospital capacity, which is this red dotted line nationally. If we get that vaccine uptake to 83%, we get to a point where hospitalizations will surge, but we don't really quite exceed our hospital capacity. There's very few scenarios here that are above that red dotted line. And so that magic line is to get to 83% of eligible people fully vaccinated, which works out to about 75% of our population. When the Ontario Science Table put out their data last couple of weeks ago, they actually had 85% of people of the eligible population fully vaccinated. So, 83, 85%, that's kind of what we're shooting for here, which works out to 75% of the total population. And if we're looking at our vaccination uptake here in Niagara, you can see with that eligible group, we're actually at 83% when it comes to those first doses. We're very close to the overall 75%. What we need to do is really get those second doses up to match that first dose number. And of course, keep doing what we can, because the higher we get more people vaccinated, that's going to help. But we're actually pretty well on track now that we've got to 83% of people with that first dose. We just need to now get them all to come back and get that second dose. So we're making progress. We're getting closer to that point. And of course, the biggest opportunity for getting vaccination rates up remains in the under 29 population, or they're a bit lower than others. Through the 30s, 40s, 50s, there's opportunity here to get more people to get their second doses. Of course, once you get over 60, we've got very good uptake where everybody, 90% of people have their second dose, and they're very quickly approaching closing that gap between second and first doses. So the 12 to 29 population remains our biggest focus, and then a secondary focus, the 30 years to 50-year-olds who have a little bit more opportunity to get their vaccination rates up. Just a final reminder here, I think, is why it's so important that we get those vaccination rates up and we keep the pandemic under control. Is really we're starting to see, particularly in the US, particularly in Alberta, where they've done much less to control the pandemic and their vaccination uptake isn't quite as good as us. We're really seeing what the costs of that are in terms of their hospital sector and in terms of actually people's lives. So, if we're looking at Alberta, these are some of the recent news headlines we're seeing, and they're bracing that their ICUs are almost full. They added beds, but they're not finding the workers to be able to work and, protect people in those hospitals. I see admissions here slamming hospitals, and the province realizes that moving to drop all pandemic precautions was too early, and treating this as now just an endemic illness similar to flu. And doctors are increasingly in Alberta warning that the health system could collapse. They're approaching the point where they have maxed out their ICUs. And of course, that's what we have fortunately been able to avoid in Ontario, because I think we took a much more careful approach to reopening. And we brought in, we never dropped mask rules, we never dropped physical distancing. We are actually bringing in vaccine certification next week, all things that Alberta hasn't done. And I think that's hopefully going to mean that we avoid this kind of scenario. But this is, of course, that worst case scenario, which is why we need to keep doing these things to avoid that. If we take a look in the US, it's not just a hit on the hospitals. They're actually seeing their economic growth slowing as people are basically, they're showing demand is dropping. People are scared of the virus out there. They're scared of venturing out. And so people are pulling back on their spending, and that's, of course, hurting the economy. Wall Street is worried. Stocks haven't apparently been doing as well either. And I think this is a reminder that as much as, our pandemic control measures sometimes are hurtful to the economy, if we don't have it, you actually see harm to the economy regardless, because people are too fearful to be out and participating in the economy. And I think we need to keep striking that balance of, trying to keep COVID under control while allowing as much economic freedom as we can within that framework, because that's going to allow both, the maximizing of our health as well as maximizing our economy. Just taking a look at the US here, headlines show that states that are, have a high vaccination uptake. So 2/3, which is similar to us in Ontario, don't seem to be doing as bad. Other places, hospitals are overwhelmed with unvaccinated patients. And, Texas is one of those states that has actively tried to stop people from wearing masks and do things to control the pandemic. And they have now run out of ICU beds. And, there's, I think, some pretty, bad stories here, even in Alberta, where surgeries are now being canceled because likewise, they're in the same place, almost facing that impact on their ICU beds. In the US, are talking about having to prioritize who gets ICU beds because there's not going to be enough ICU beds to go around. This morning in the Washington Post, there's this quite unfortunate story about an Alabama man who actually had a heart issue, needed to be hospitalized, but there wasn't an ICU available. The hospital called 43 other hospitals in the surrounding region and couldn't find an ICU bed for this person. And unfortunately, this individual ended up passing away. And these are the kinds of things that would happen, of course, if we let COVID get out of control and didn't have any ICU beds. And we're seeing, I think, in Alberta, in the US, exactly how bad that is. And even short of ICU beds being lost, you could even see hospitals running out of supplies, such as this, state of Hawaii running out of oxygen in their hospitals. There's some stories coming out of Alberta from the healthcare workers, which I think are quite interesting. So this is an ICU doctor, Dr. Ryan Chowdhury, who's talking about younger people are more and more those here seeing the hospital, which sort of makes sense because younger people are the ones who are least likely to be vaccinated. And they're rapidly needing more and more oxygen. They're needing to be put on life support, getting all kinds of invasive procedures. He talks about this man in his 40s had to be put back on a ventilator, asked if he wanted to have his family come in. He said he didn't because they could be exposed and they're all seniors, and had to send a text to his family and, discussing his funeral arrangements, apologizing them for the situation. And, lots of regret from these kinds of people about not being vaccinated. People who are vaccinated, they're not the ones who require these really intensive interventions that these, ICU doctors are seeing. It's the unvaccinated people who are often feeling regret about this. And so, I think it's just driving home in really personal terms how important it is for those people who haven't yet got vaccinated to really get vaccinated so we can avoid seeing these sorts of stories occurring here in Niagara. This is one last story I'll just share here, which is this was a man who had a cancer, had lots of radiation therapy. And actually what that radiation therapy did is it unfortunately damaged a lot of his skin, and actually he had exposed bone in his head. And so he was going to get skin grafts. He came to the hospital early in the morning for a surgery. They got him all prepped, ready to go. But unfortunately, all of a sudden, all of their ICU beds were occupied. And in case something went wrong with the surgery, they needed an ICU bed available. So unfortunately, this individual had to have their surgery canceled. They're continuing to have to go about life with that exposed bone while they wait for a point where ICUs are once again open so that they can actually go ahead with this individual's surgery and he can start to recover from that terrible cancer and experience with that. And, these are the stories that I think we need to, avoid, which is why I think it's so important we continue with the path we are on in Ontario about continuing to promote vaccination, bringing in modest restrictions like vaccine certificates to limit the spread of infections, maintaining the restrictions we have in society, so we keep our ICU capacity available for those who really need it. We don't see a surge of hospitalizations, and we don't have to eventually resort to something like a lockdown, which we had to with our first waves when we did see our hospitals and our ICUs threatened. So with that, I'll stop and turn it over to questions.
Okay, thanks. So as always, we'll move through, give everybody a chance for one question and one follow-up, and then move into...
My camera turned off, so apologies for that.
No problem.
I found Zoom has been doing that to me increasingly, where it just dies on me.
Okay, so to start, we have Dawn. You should be able to unmute now.
Oh, sorry. I just trying to find the mute button there, and then trying to find you just on my screen, the window. Yeah, Dr. Hergy, thanks for taking my question. I think with your last piece there, I was going to ask you anecdotally about that ICU admissions. And the reason being is just Hamilton Health Sciences today sent out a note where they were saying their ICUs are now every patient with COVID in an ICU 100% unvaccinated, and it's the same at St. Joe's now. And then you just gave me the Niagara Health numbers. I just kind of wanted to get your thoughts on that, on because both we had doctors from both the two big hospitals in Hamilton, and they were saying the same thing about surgeries, and they weren't overly happy about that, I guess is the best way to say that.
Yeah, well, I think through this pandemic, there's been a lot of surgeries, a lot of procedures, a lot of healthcare that got deferred. Through our previous waves, we've had to cancel those so we could redeploy those staff towards working in ICUs and caring for COVID-19 patients. So there's a huge backlog of that to catch up with. As well, I think just given fear of the pandemic, people have maybe deferred getting some routine care and stayed home to stay safe from COVID. And that's meant in some cases that the illnesses they have now are actually a little bit more severe, and they're actually now requiring hospital care that they might not otherwise have needed. And of course, the more we delay that, the worse it's going to get for them and the more intensive care that they're going to need over time. And so there's a huge demand and a huge need to start catching up on a lot of that missed care and deferred care. And if we are dealing with a surge of COVID cases, all that's going to do is mean we miss more of that care, we defer more of that care, and we're going to make the problem even worse. And so I think it's really critical that we find a way to keep COVID under control, especially now that we have the tool of vaccinations. We can do it without really doing significant harm to the economy, without having too many restrictions in our society, hopefully. And that'll allow our hospitals to maintain control, actually maintain the ability to care for all these patients who have had these deferred issues, and hopefully, catch up on all of that care over the next couple of years.
And a follow-up?
Yeah, my follow-up actually also might be anecdotal as well, and it has to do with testing rates. And so when I look at, when you were talking about a couple of weeks ago about Hamilton, kind of being the epicenter, I noticed their test rate is absolutely huge. It's over 2,000 per 100,000. And I was looking at some of the other regions that also have high percent positivity rates, like Windsor, Essex, and Chatham, Kent, and Toronto, and they do like just massive tests. Whereas Niagara, as far as I can see, they're doing half as many tests as those regions do. Can you kind of talk to that? Is it a case where it's just easier to get a test in those other regions that I mentioned, or than it is in Niagara? Or can you speak to why there would be half as much testing?
Yeah, so when your cases go up, tests actually tend to go up along with it. If there's more cases, you're likely having people spread infection to more others. So more people are becoming symptomatic and going for testing. As well, a big part of what we're doing with our public health follow-up is once we find contacts to a case, we're often sending them for testing. Or if we're searching for where was the source of infection that led to someone, we're sending them off for testing. So there's actually a correlation that when cases go up, you're actually also increasing the number of testing you're doing. Hamilton for quite a while has actually had probably about double the cases that Niagara has had. Hamilton was getting into the 80s, 90s, over 100 cases a day, where in Niagara, we've been in the 30s, 40s, occasionally dipping into the 50 cases per day. So I think it kind of tracks that if they've had twice as many cases, they've had twice as many people getting tested as compared to Niagara. I think it's probably a reflection mostly just how many more cases Hamilton has had than Niagara's had. Likewise, how many more cases a place like Windsor, Essex, or Toronto has, and the testing reflecting that. I don't think it's likely an indication that tests are harder or easier to reach in any region.
Perfect. Thank you.
Thanks. Up next, we have Ludwig. You should be able to unmute.
Thank you. Hello, everyone. Hello, Dr. Hergy. Well, I was just wondering a little more about the testing. We're a good almost 2 years into the pandemic, and I imagine you're seeing quite a drop in testing. So the question is, if there's any possible way to quantify or guesstimate, if you will, what the actual number of COVID cases in the community is right now, because as of this morning, we have 300, but I imagine that the number could be higher than that due to many infections going undiagnosed. So if you could speak a bit about that and the challenges that come with that from a, tracking public health standpoint. Thanks.
Yeah, we always worry that when people aren't being tested, that we're going to be missing cases. And I think it's, very likely we are at least missing some cases. What is a bit reassuring that right now, when we track back any new case, we're really able to, track back those chains of transmission back to someone we knew as a case. We're not really finding a lot of new chains of transmission or, previously identified chains of transmission. So we're relatively confident that we're probably not missing very many cases. I don't want to give, a really, hard and fast number. I would imagine we're probably on the order of 80 to 90% of chains of transmission and cases that are being identified right now. It's probably a relatively small number that's going missed in our community, fortunately.
And a follow-up?
Yes, thank you for that. Okay, so we have that now. Obviously we are about 2 weeks away, as you said, from the implementation of the vaccine passport. So from what is public health doing, or rather, are you doing something from a local standpoint to assure that businesses, places are ready to sort of handle this? Like what does the work look like there in educating business owners on how to approach that and so.
Yeah, so one of the difficulties here is actually the province hasn't yet released all the details of what this is going to look like. So we have limited information that we can share with our private sector business partners. The province has said that the week of September 13th, so this week, they would come out with those details. Once we get those details, we're going to be using the channels that we have to try and make sure we spread that information to the business community so that they're aware. We also have a phone line that the business community can call where we give advice around COVID, putting measures in place to protect your workplace and the like. And that'll be an opportunity as well for if they have questions, they'll be able to reach out to get some information from us. Obviously, I think since it's the province's rules, it's probably best that they call the province to get the information directly from them, but we always are available to speak to as well.
Thanks. Up next, we have Paul, and you should be able to unmute now.
Can you hear me okay? Oh, good, thank you. So Dr. Hergy, with the current rate, the current trends we have of things flattening out a bit, I know you said that's maybe a short-term thing, we don't know, but between that and the passport, could we, do you have any estimate when we could get to this 83, 85% vaccination rate among eligible adults, which you said could be very important in helping to avoid hospitals being overwhelmed? Do you have any idea when we could get there based on current vaccination rates?
Based on current vaccination rates, it would be pretty slow going to get there. I'm just trying to do some math in my head. We're probably looking at least 2 months at our current rate of vaccination. Now, when we look at our vaccine appointments, we see actually a huge number of people have appointments between the 18th and the 25th of September. And I'm not really sure why that is. Is it people thinking that, September 22nd, so around then they're booking an appointment? Perhaps that is. Of course, you need to be fully vaccinated 2 weeks before September 22nd or whatever date you're going to show up at one of these settings after that to be considered fully vaccinated. So I would argue that's leaving it too late, and you really should be going as soon as possible to get your vaccines. So you get that second dose as early as possible and get to those 14 days as early as possible. Or if you haven't even got your first dose, making sure you got that first dose so you have as early as possible, you can get that second dose, get those 14 days under your belt, and be ready to access those settings. But with those big numbers of bookings really happening next week, I am hopeful that we'll move up that 2-month timeline by quite a bit. Maybe a month from now, perhaps we could be getting to those numbers. This is all sort of guesswork, though. Do we see a big surge of people and then it falls back down to being slow? Do we see people who maybe didn't pay a lot of attention to the provincial announcement, didn't hear about it, didn't take it seriously, actually showing up to a restaurant and finding, oh, I can't actually go in and dine, especially as weather gets cooler and people maybe don't want to be outdoors, they want to be indoors part, finding out that it's actually having an impact on them, and that may be prompting to go get vaccinated. Maybe there'll be more vaccine policies brought in by the provincial government. We know, of course, they've brought in rules for the health sector. There could be rules brought in for other sectors maybe as well. All of those things could play a role in speeding it up. So, Optimistically, I would hope that maybe it could be done in about a month, but we'll see if that transpires.
And a follow-up?
Great. And with the Don Mitchell had touched on this, but with Hamilton Health Sciences announcing they've had to cancel surgeries, do you hope with the numbers we have in Niagara, the trends that could be avoided as we go into fall and winter, or do you think it's very likely we could see once again surgeries canceled and then large backlogs created?
Yeah, I don't want to say it's very likely, but it's definitely very possible. I think the situation is pretty fragile right now. Cases could start to go back up. We fortunately not seen, something as challenging as what Hamilton has seen. And so that's placed as well. And I'm hoping with a bunch more people maybe getting vaccinated in a couple of weeks from now, that's going to put us in a better place. Obviously, the higher those vaccinations go, the safer it's going to be, and slower you would hit that point where we might need to start canceling surgeries, other procedures, and buys us more time to hopefully get to that 83%. So, I'm definitely hopeful that we can avoid it. I certainly think it's possible, but it's also very possible that we don't get vaccinations quickly enough, and we do face what Hamilton has had to face.
Thanks. Up next, we have Richard, and you should be able to unmute now.
I don't have any questions today. Thank you, though.
Thanks. Okay, then up next we have Penny, and you should be able to unmute.
Hi, yes, my question has to do with vaccination rates and hospitalization rates. It seemed that maybe 2 weeks ago, the conversation revolved around people who were quite surprised by the percentage of people who were partially or fully vaccinated still testing positive for COVID. That seemed more than was expected. But today, when you talk about the fact that 0% of those who are hospitalized in Niagara are vaccinated, it would seem to me that's a really important distinction and a really important message to get out to people who are still sort of on the fence about being vaccinated.
Yeah, so, I think what we've seen is that, no vaccine is perfect. We do see people occasionally still getting sick despite being vaccinated. But when they get sick, it's actually much less likely that they're going to be severely ill and need to be hospitalized, and much less likely they're going to pass away. So the benefit you get of preventing infection is large, but the benefit you get in preventing hospitalizations, severe illness, or death is actually even larger than that. And so it's all very good news on that front. And, I think, long term, we're not going to completely eliminate COVID-19. It's going to be in our society. But our hope is that we can basically, with vaccination, render it to be basically a cold virus. And vaccination, I think, has the potential to do that, to really make it a very small number of people who are going to get severe illness.
And a follow-up?
No, that's okay, thanks.
Thanks. And then up next we have Gord. Should be able to unmute.
Okay, hi, thanks. You'd mentioned outbreaks in food service sector. I wonder if many of those cases involve staff, or are they largely customers? And if so, if some of these venues, are they being good about collecting information so that you can do contact tracing?
Yeah, for the most part, we found the venues have been pretty good with collecting information. We've definitely seen that it is more staff who are becoming ill in these outbreaks increasingly than patrons. Not to say it's been zero amongst patrons, there's definitely been cases amongst patrons, but the majority has been amongst staff. And I think unsurprisingly, a pattern we see is that those staff are unvaccinated staff. And so, one of the things that I think would really stop these outbreaks would be if restaurants, really encourage their staff to get vaccinated, because if you can get those staff vaccinated, I think that could actually put an end to those outbreaks.
And a follow-up?
I wonder, school sports have started or are starting, and more indoor sports are going to be starting up, minor hockey, things like that, basketball, I guess. Is that something you're keeping an especially close eye on as cases, continue to grow?
Yeah, it's definitely something we're going to be keeping an eye on. You may have seen in our graphs that we did actually have a small part of that pie of outbreaks was actually athletics. We have seen outbreaks linked to people engaging in athletic activities. Many athletic activities, it's hard to stay spaced out when playing, but even the bigger risk from that is in a change room, sitting on the bench. Often people are very close together. And so we're the minimum trying to encourage, schools where they're running athletic activities to make sure we keep as much space as possible, maybe have people change, elsewhere, not in the change room, so we can minimize that risk of spread. But we're going to be keeping an eye on to see what happens and what might be driving outbreaks so we can refine that guidance. In the worst case scenario, we could go down the road that Toronto, of course, took, where they have put an order in place to stop all of those athletic activities. We don't really want to take that step yet. At least we'd want to at least see if what's been put in place is enough to keep those outbreaks from happening.
Thanks. We still have a few more minutes. So if anyone has a second question, if you want to type in the chat, we can get to those questions as well. Okay, see one from Ludwig. You should be able to unmute now.
All right, thank you. Of course, today we're seeing a lot of reports about protests outside of hospitals in Toronto. I haven't checked the latest news, but I imagine there's some commotion going on in different localities. It's no news that we've had a pretty vocal anti-vax movement quite from the start, and various groups who seem to be tying this to different authoritarian movements, et cetera, et cetera. There seems to be a wide range of discontent in this group. What is public health seeing from this? We're hearing about people being accosted at vaccination sites in the past, et cetera. From your sort of view, how much hostility, adversity is public health staff facing now, if any?
Yeah, we've been lucky at our vaccination clinics that while we've had angry people who are upset that they're coming and, feeling like they're being pressured to get vaccinated, we haven't had any kind of big protests or anything, worse than that, such as, actual physical accosting violence. So that's good. Definitely there's been a bit of verbal abuse, which is definitely unfortunate, but certainly not something that's been too difficult to handle. Where I think we're actually seeing things much more acutely is actually with our case management, our contact tracing work. People who I think took COVID very seriously, were concerned about it, are overwhelmingly the people who've also got out and been vaccinated. There seems to be this correlation of people who don't take COVID seriously, think it's a conspiracy, are opposed to masks, and actually are also opposed to vaccination. And they're increasingly the group who is becoming the cases because they're the unvaccinated people. They're the highest risk. And we're finding often we don't get very much cooperation from them when we're trying to do contact tracing. They aren't giving us honest information. They're not willing to give us the contact information of people whom they were around where COVID might spread. They're often maybe not even picking up the phone, returning our calls. We're finding that part very challenging right now. And I think that's where that's playing out the most.
Thanks. And we also have a second question from Gord. You should be able to unmute.
Okay. You had the pop-up clinic at the outlet collection on Saturday. I wonder how productive that was and if people can expect to see similar ones, say at Ice Dogs games and River Lions and other settings like that.
Yeah, the pop-up this weekend, I'd say, was okay. It wasn't as busy as we'd hoped it would be. We did 99 people we vaccinated at that clinic, so fairly modest number. It sort of seems, really day to day. It's very variable how many people. Just to give you the example of the McBain clinic, on Friday I think we had over 300 people there. On Saturday we had a little over 100 people come. Why is that a big jump? I don't know. The day before that, 300 plus people, we're also, only around 150 people or so. So we're not really sure why certain days people are all of a sudden willing to come out and get vaccinated and not so much other days. We're definitely looking to see where additional pop-up clinics would be. Those, kinds of sports games you talked about are an option. We'd really have to see what is the setup at those clinics and in those arenas, and does it make sense? As well, I think a lot of sports organizations are likely going to limit their attendees to people who are vaccinated, which means you might not actually be catering to the population you're trying to access if you're actually showing up to those. What we're really doing is looking at data, trying to identify geographically and demographically who are the pockets of population where they're disproportionately low in vaccination, and then trying to hit up centers where we expect that they're going to be. So if this is a geographic area where there's low uptake, let's go to community locations there and set up clinics that are really easy to access. If there's people defined by this demographic, and we know from marketing data, they tend to go shopping in this kind of place, that's a place that we're going to try and be. And so we're going to really use data to drive it, rather than just hitting any sort of place where there's going to be big crowds.
Okay, thank you. And not seeing any more second questions, I think we'll leave it off there. Thanks everyone for coming, and we'll see you in a couple weeks.